Hello, I'm from Radboud University Medical Center in the Netherlands. With a group of 15,000 people, we try to deliver great healthcare to our members. We got at present 1,000 beds, and our actually ambition is to close down 500 of them in a way to say that we have to drill down because of the healthcare is doubling in demand within the same budget, so we have to come up with smart things. And we really think that technology is one of the opportunities that we could step into. So from this ambition that we set earlier on in 2012, we see all this technology getting smaller and smaller, getting cheaper and cheaper, and medical devices actually are getting tucked into consumer devices. And we really think that in this world that's connected on a daily basis everywhere worldwide, that's a huge opportunity we really could get into. On an annual basis, there is research being done by the Dutch government that you can see in terms of monitoring the progress in terms of e-health, and I like to call this digital health, of course. What you can see is that there's only a small uptake still. Almost in some of the aspects, there's a lot of offering of opportunities and the users do not use it on a daily basis. We can see that medicine dispensers, for instance, are in the 20%, just like the video calls are in the 20%. And some of the critics could say that also that the healthcare access, for user access to their medical information online, with adding comments, making prescription medications and reordering them, but also the laboratory results are still in the lower 20s. And that's exactly where some critics say, well, I don't think that people want to use it, and maybe it's not of use at all. But we really think that this is only the beginning. Just like we now see that there's an uptake at one end from the exchange of medical information between healthcare companies, for instance also in pharmacies, you see a great uptake into it, we really think that we're just on the verge of it. Just like the iPhone moment, it took a while with all the hurdles to take in legislation and finance, but also in terms of educate people that they really do want it. At one moment in time, the tipping point was touched, and that's where things started to move. When you ask people, the general public, where good healthcare will be delivered in 10 years from now, they would say to you, and this is a poll with 1,600 people in it already, that only 2% in 10 years from now will be delivered at the doctor's office. 10% at hospitals and 20% in people's homes, leaving about 70% everywhere. And I really think that that indeed is the case. And also with the doubling of healthcare demand and the growing people above 65, for instance, that within the next 15 years will double, we also see that the first generation of Rolling Stones fans gets admitted to elderly homes. And they use technology more and more, from iPads to smartphones and other stuff. And the other group that's coming up are the millennials, or the Generation Y actually, that within 20 years from now will have the same healthcare demand as now the elderly. So we also have to be prepared for people who actually live in technology already. And that's where we think that academical healthcare actually will shift into subclinical healthcare, from subclinical healthcare into the supermarket, and then into people's homes. But let's be honest, you're not at your home right now. You're not even at your work right now. And still, you got your smartphone at elbow reach 24/7. That's also why I really think, and this is a calculation that I made in the end of 2014 for my board, that 70% of all the routine measures that we do at Radboud in the end of 2020 no longer will be done at our own campus. And that's also why we said we need to come up with a new strategy that we call digital first, physical next. Together with patients, we try to create and co-create the most optimal services for them that they can use and that they will use if they're able to it. With some of the conditions, and for some people it's not possible. But let's imagine if only 20% of our total population patients will start to use that. Then the amount of time that we could free up to help resolve the doubling on healthcare demand, or to have more time and more exposure to our patients themselves. And I run into a lot of people that think that digital is the same as now analog or paper, but just translating it. And that's actually not the case. It's building your services up from grounds up, completely renew. You have to rethink your whole model. And that's also something that to take into account. It's no longer about Canada or about the Netherlands or Ireland or whatever. Healthcare is becoming globalized and it's becoming a software business. And that's also one of the reasons why we collaborate with a lot of great companies all over the world and try to push the needle a bit one step at a time. And also are creating a global network of healthcare innovation centers, not only in the Netherlands and not only in the United States, but also in Canada with great partners like Mars and Sint-Elise. And I'm also very happy that my dear friend and colleague Zena Kayat is now on a secondment for a year at my Reshape team, helping me with this global network of healthcare innovation centers. And every step in this, of course, is being stepped together with patients right from the get-go. And that's something that we try to, what we really don't take into account in a lot of eHealth projects. We create these patient journeys, where we all know that the patient journey within the institution is a bit smaller. And even within the institution, you could easily run into separate, multiple healthcare professionals. But what patients tell us is that the best and the biggest journey of all is their journey of life, where the majority of the choices that they want to make is based on the whole life journey and not only on something that's happening only within healthcare. So that's what we strive to create, experience-driven healthcare. Evidence-based, of course. We have to prove that it really does work, but still it's completely flipping the coin from a perspective into the patient's perspective. Wrapping up, I think that there's 4 pillars to this change that's coming up. My 4 Ds. First one is about delocalizing healthcare. We can do stuff in a completely different place. Secondly, it's about democratization of healthcare based on the fact that data is shifting from the professionals to the citizen and the patients. Patients are creating more data themselves than we as professionals, so we have to take a subscription on their data as opposed to the other way around. And the third D is about digital. Not only in terms of technological perspectives, but also if something's invented in India and been published this afternoon, within a week it's in the United States or in Canada or in the Netherlands. As opposed in the early days, it took sometimes months or even years to know about this. And the last D, of course, is about dollars. Big investments like tens or hundreds of millions of dollars needed to be invested in infrastructure to enroll these kind of things. With that, I think that we also could re-quote what Einstein once said. We have to stop use old maps to explore new worlds. And I really do think that's true. But to quote one of the other giants, Darwin, who also said it's not about the most intellectual or the intelligent people. It's more about the bunch who really are open to change and to adapt to that. And that's also the reason why we created the first ever health innovation school in the Netherlands, to get as an initiative from Reshape, co-created with the Ministry of Health, also with the help of Zena Kayat, by the way. And we now are stepping into teaching new and emerging leaders that will be responsible for health and healthcare in 5 years from now, how to work in this innovative field with exponential growing technology. With that, I really would like to give back to the moderator and would love to take your questions afterwards. Thank you very much.